Hi everybody, this is Dr. James Reed, chiropractic physician and certified functional medicine practitioner. Today we're going to go ahead and take a look at fibromyalgia. Of course, that's a very big topic and so on. And what's kind of interesting, we want to kind of focus today as far as maybe some of the underlying causes of fibromyalgia. One of which you may not have even considered has to do with your digestive tract. That's kind of interesting, the connection. Now, just to kind of revisit fibromyalgia, it's a multifactorial, multi-organ system involvement. So what do I mean by that? Well, it involves obviously your nervous system. It also involves your muscle skeletal system, so your muscles, your tendons, your ligaments, your joints. It also involves your immune system. And the reason for that is that your immune system actually influences inflammatory conditions in the body. The other thing too is also your body's ability to produce energy. So it also could be at a mitochondrial level. And so we have to think of all these things and how they influence the body and can actually result in, fibromyalgia types of symptoms. Well, how does this all tie into digestion, Dr. Reed? I just don't really get it. Well, to begin with improper digestion, you're not going to get, proper absorption of proteins, for example, which are crucial for the health of your muscles, your bone, your joints. Proteins are important for proper immune system function and also nervous system function. And you also have to have proper proteins too in order for your mitochondria to function as well. So, and of course, a lot of these proteins turn into enzymes, and enzymes are so important for just all biochemical reactions in the body. So you have to think of it in those particular terms. So if you're not getting proper absorption of your proteins, that can be a big issue. And where does most of that usually occur? Usually at the very beginning of your digestive tract, your stomach. So having, symptoms of like GERD or acid reflux, heartburn, maybe chronic coughing, clearing your throat all the time, having gastritis or discomfort in your stomach. These could all be signs that your stomach's not operating correctly and you're not digesting proteins and some other nutrients, in your body. Another important thing is mineral absorption. So the stomach is crucial for mineral absorption such as iron. Okay. Now, iron is interesting is that, iron is very important for the production of your red blood cells. And iron is important for, guess what? Energy production. Okay. Guess what too? Iron is also important for the production of collagen, which are the fibers that make up your joints. They make up your ligaments, your tendons, your bone, all right, and other connective tissue. So if you don't have proper iron levels, that can affect your energy. That can also affect the quality and strength and integrity of your connective tissues. So, and again, what's also interesting is that iron is also important for a molecule in your muscle called myoglobin that actually carries oxygen to the muscle as well, in addition to the hemoglobin that's found in your red blood cell. So just another thing that can affect actually muscle strength and maybe lead to muscle weakness and so on. So again, where does that take place? Iron absorption, the stomach. So another mineral to consider is calcium absorption. And again, the stomach is crucial for proper calcium absorption. And of course, calcium we all well know is for our bone, our teeth, but it's also important for proper conduction of nerve signaling throughout the entire body. Calcium's used in so many other types of metabolic functions in the body as well. Another mineral would be actually magnesium. Now, magnesium has to be absorbed, and it starts here in the stomach. I know most of it is usually absorbed in the intestine, but it starts here in the stomach. And magnesium, that's very important for proper nerve signaling. It also helps to relax and calm people down. It's also important for proper relaxation and contraction of muscle tissue. Magnesium is also crucially important in the energy production cycles in the body as well too. And it's involved with 300 plus other types of metabolic functions in the body. So if you're not getting proper magnesium absorption, that definitely can affect your nervous system, the mitochondria, energy production in the body, proper function of the muscles. As a matter of fact, a lot of times we'll go ahead and prescribe like magnesium malate to also help with some of the problems with the muscles, particularly when somebody is having symptoms of fibromyalgia. So magnesium cannot be ignored whatsoever. Okay, so another important mineral would be manganese, not to be confused with magnesium that we just talked about. Now, manganese, all right, is actually very, very important for, we call it like cross-linking of collagen fibers. So it's important for making sure that you have good, strong connective tissue. But what's also interesting too is that manganese is actually incorporated into an antioxidant called SOD, or superoxide dismutase. So if you're deficient in manganese, you may not have enough of this particular antioxidant, which helps to reduce inflammation throughout the body. So this is why, proper absorption of manganese is also important if you have, symptoms of fibromyalgia. So I'd also like to add too is that if you do have, some problems with your upper digestive system, that it can also influence actually the small intestine and the absorption of nutrients here. It can also affect, the overgrowth of maybe different kinds of bacterium or yeast, which can affect your absorption of nutrients as well. It could also elicit an inflammatory condition in the body. And we realize that 70 to 80% of your immune system is located mostly in your intestinal tract. So if that's not functioning correctly, your immune cells that are embedded in your small intestine will release different cytokines, which are inflammatory molecules that can cause inflammation throughout the body, like in your nervous system, in your muscles, your joints. It can interfere with energy production in your body. So just to go ahead and mention again that your digestive system can be very important in how it can influence some of the symptoms that you might be experiencing with fibromyalgia. And of course, that could be your brain fog, your lack of concentration, chronic fatigue. It can also be the chronic, pain that's found in muscles and joints and so on. One other thing I wanted to kind of add too, if you're not getting proper absorption, it can also kind of foster a change in hormone levels, and it can also begin to affect actually bone density. So, osteoporosis or osteopenia. So I want to try to add that on as well too. So having proper absorption of your nutrients, your proteins, minerals, and there are other nutrients as well too that are important to your health, and making sure that you avoid or minimize, the effects of, fibromyalgia. And that may be some root causes, and a lot of times we don't even think about that. So what are some of the things that you might be able to do if you think that some of your fibromyalgia symptoms are tied into your digestive problems? Well, one of the things would be to go ahead and kind of look at your diet. I'd recommend that you use more of an anti-inflammatory diet. We do have that listed on our website. You may want to add more plant-based foods. Try to avoid, smoking. Of course, losing weight is a very key and crucial thing. Some of the things that can also upset your digestive tract would be alcohol. We find chocolate, yes, okay. Chocolate can actually be a problem. Yes, I know dark chocolate has antioxidants, but in some people that can really cause some problems. There could be some other food sensitivities that you might be experiencing too that are causing problems with your digestive tract. Now, not everybody's the same when it comes to digestive problems or what's causing some of their fibromyalgia. But if you suspect your fibromyalgia might be tied into your digestive system, We'll do an individualized evaluation to find out which appropriate treatments, what kind of evaluation and tests that might be necessary to see what's going on. I mean, it could be a blood test, it could be looking at food sensitivities, stool or urine analysis too. That can all give us some information about what your particular problem is and what we need to do for you individually. If that sounds like something that you would be interested in, go ahead and contact our office at 480-732-0911. I hope all this information is helpful for you, and thank you for watching the video. And just to remind you, I wanted to go ahead and let you know that we have other resources both on my website, which is azfamilyhealthcenter.com, and also on our YouTube channel, where we do discuss fibromyalgia, we discuss some other digestive issues and other things. And then we also have information about some of the different diets as well too. They're available on the website, and also some of the different testing that we provide at our office. So once again, thank you for watching the video.